All right, we are recording. You guys ready? Yeah. Okay. Hi, I'm Cassie Mikesell, and my fellow group members is Leticia Yanis and Isabel Patton, and we are the Pink Tulip Helpers, and today we're going to be talking about substance abuse. When we started this presentation, we didn't realize how broad of a subject substance abuse was, and so we had to kind of narrow it down a little bit. Substance abuse can, but is not limited to alcohol, tobacco, opioids, stimulants, hallucinogens, prescription drugs, prescription and over-the-counter medications. Imagine this. Every minute, someone's life is drastically altered by drug and alcohol abuse. Not in far-off places, but close to home, in our communities, families. It isn't just a public issue, it's personal. According to the 2022 United States National Survey on Drug Use and Health, 46.8 million Americans ages 12 and older battled a substance abuse disorder in the past year. Today, we dive into this complex world of substance abuse. We will uncover how this crisis not only impacts individual lives, but also strains our healthcare systems, economies, social structures. We will examine our current challenges, investigate root causes, explore effective solutions, and help mitigate this epidemic. Join us as we navigate these pressing issues, armed with data, personal stories, and the call to action that could lead to transformative changes in our society. Leticia will now be discussing the problems with substance abuse.
Okay, hi everyone. I'll be speaking about our problem. I'm going to start off with our first main point, which is escaping reality through substance abuse. Every day, countless individuals face stressors and hardships that can feel overwhelming. For some, the allure of substances becomes a tempting escape from these realities. Substances like alcohol, opioids, and even nicotine alter brain chemistry rapidly. They can significantly boost dopamine levels, which influences the brain's reward system, leading to feelings of euphoria. This chemical release is a key reason why substances are so appealing. They provide a quick, though temporary, lift in mood and perception, making problems seem less intense and more manageable. As the effects wear off, the harsh realities return, often more intensely. This can lead to a dangerous cycle. It starts with initial use, often experimental or occasional, but as tolerance builds, more of the substance is required to achieve the same effect. Over time, dependence forms, making it difficult to function normally without the substance. This can escalate into compulsive use. While substances might promise an escape, they often deepen the very issues they were used to avoid, like financial troubles, dropping relationships, and declining health, are just some of the real-world consequences faced by those caught in this cycle. Moving on to the next slide, according to Nicholas Lessa from the article Living with Alcoholism and Drug Addiction, mental problems that result from substance abuse and mental illnesses itself is a recognized cause of substance abuse, risk for developing alcohol and other substance abuse-related stressful families. Children diagnosed with anxiety or depression are also more likely to become substance abusers. So now we're moving on to why substances appeal as an escape. The first one may be psychological escape. Many individuals turn to substances as a way to cope with daily stress, emotional pain, or traumatic experiences. The immediate effects of substances can provide a temporary but powerful escape from reality. Dopamine release and euphoria. Substances such as opioids, alcohol, and nicotine trigger the release of dopamine in the brain's reward system, leading to feelings of pleasure and euphoria. This biochemical reaction not only creates a pleasurable high, but also reinforces a behavior encouraging repeated use. Social and cultural factors. In some social circles or cultures, substance use is normalized or even celebrated, making it more appealing. This can include social drinking, recreational drug use at parties, or smoking as a communal activity. Okay. According to the textbook, brain and behavior research shows that the type of trauma experience can influence substance use patterns. For instance, individuals exposed to non-assaultive trauma tend to start using substances at an earlier age compared to those who have experienced assaultive trauma. Um, Looking at this diagram, we could see that the drug is intertwined with biology genes, which is the genetics, the gender, and the mental disorders, as well as the environment, which can include a chaotic home and abuse, parents' use and attitudes, peer influences, community attitudes, or low academic achievement. Okay, so now we're going to talk about the cycle of addiction. The journey into addiction often starts with experimental or occasional use driven by curiosity, peer pressure, or a desire for emotional relief. That goes with the initial use. Moving on to tolerance development, over time the body adapts to the substance. Higher doses are required to achieve the same effects, which can quickly escalate use. This adaptation leads to physical tolerance, a hallmark of many addictive disorders. Next is dependence and withdrawal. As tolerance builds, the body becomes dependent on the substance to function normally. Withdrawal symptoms without the substance can be painful and distressing, reinforcing the need to continue using to avoid discomfort. And ending it with compulsive behavior, eventually the use of the substance becomes compulsive. This means the individual spends significant time obtaining, using, and recovering from the substance. Social, occupational, and recreational activities are neglected or abandoned. Okay, now we'll be talking about main point 2 for our problem, which is mental health and its connection to substance abuse. Deep dive into specific disorders. So let's take a closer look at how specific mental health disorders such as depression, anxiety, and PTSD intertwine with substance abuse. Understanding these connections is crucial for addressing and underlying causes of addiction. Starting with depression, this disorder is often linked with decreased levels of neurotransmitters like serotonin and dopamine. Individuals suffering from depression may turn to substances as a quick fix to elevate their mood. However, this relief is temporary and often worsen depression symptoms over time. Moving to anxiety disorders, this these involve an excessive and persistent worry that can be draining. Substances like alcohol and sedatives provide a temporary calm, but they can increase anxiety after they wear off, leading to a vicious cycle of increased use. For those with PTSD, substances may be used to numb and intense emotional pain and intrusive memories associated with trauma to manage the overwhelming flashbacks and emotions. The relief provided is short lived, and reliance on substances can quickly develop into addiction. According to what research tells us, substance use and misuse from a systems perspective, alcohol and drug related problems are seen as an outcomes of community that can impact everyone within the community, though some groups may suffer more due to various individual and environmental factors. Okay, now I will be transferring over to our next speaker, which is Isabel, and she will be talking about accessibility to substances.
Hi, everyone. As we saw in Leticia's main point, escaping reality through substance abuse is a major cause of this and the accessibility to substances. Having availability and accessibility to these substances has become increasingly easy as years go on. Alcohol is one of those substances. Many people don't consider alcohol a type of drug. However, it is one of those things that has the possibility to alter our brain and its capabilities, and not in the best way. Alcohol can be bought over the counter at many pharmacies, grocery stores, gas stations, and more. As we see in this quote here, according to the Substance Abuse and Mental Health Services Administration, In 1.8 million adolescents aged 12 to 17 initiated alcohol use in 2021, whereas in 2022, 52% of high school seniors used alcohol within the last 12 months. Early initiation of alcohol use is viewed as a risk factor for developing alcohol use disorder, AUDs, later in life. That is over half of high school seniors abusing the use of alcohol. And it's sad to say many young adolescents will obtain this from relatives or other friends without question or hesitation. Along with alcohol, prescription medications are becoming used and abused. The easy accessibility to prescription medications, many people will simply get it from the doctor or their pharmacist. People continuously lie to the system and will try anything, being that is simply accessible drug. In the second quote here, according to the Child and Youth Care Forum, a study in 2016 said, although the primary focus of prescription drug abuse epidemic in public health and the media has been opioids, non-medical use of prescription depressants and stimulants among youth are becoming increasingly problematic as well. Approximately 8% of youth reported lifetime use of sedatives, with about a third of those reporting misuse. This quote explains that people with access to these depressants are misusing them and using them for non-medical functions simply to feel something or nothing at all. Next slide, please.
Sorry.
The second problem that Thesia pointed out is the idea of mental health and its relation to substance abuse. Therefore, many people who struggle with mental health are also leading to causes with addiction as well. People will seek substances as a source of medication. When people suffer from mental illnesses, they can tend to feel nothing at all or everything all at once. And while using substances in some circumstances can be beneficial, many times people will abuse the idea. According to the Substance Abuse Research and Treatment article in 2022, they found that suicide is among the leading causes of death in the US, and the adjusted rate for suicide in 2018 was the highest since 1941. The suicide rate in the US has risen an average of 1.5% a year since 1999. If this rate of increase continues, the suicide rate from 2000 to 2050 in the US is expected to double. Cannabis has been linked to SIB, self-injury behavior, along with depression and anxiety, which are two major independent risk factors for suicide. Suicide rates are continuously increasing, and sometimes using substances for this is the simplest way to do this. The correlation with substance abuse and the ideas for suicide are highly compatible and going to dangerous numbers. In the next quote, from a national study done in 2019, the interaction terms showed that in the presence of unmet needs for mental health services, there was an amplified association for suicidal ideation, major depressive episode, and alcohol abuse with violence perpetration. Therefore, when not meeting the needs of mental health services for people, and the help and contribution throughout that process leads to many downside effects. With less of those resources, there are higher rates of substance abuse issues. Now we will hear from Cassie speaking on some solutions and treatment options for all these issues.
So we found that personalization of education and prevention was probably the most used, the most used and personal, making it work the best. So according to Angela Moreland, Christina Lopez, Amanda Gilmore, April Brinkman, Jenna McCauley, Alyssa Reinhold, and Carla Danielson in a 2020 study found that participants also mentioned education on when recognizing when someone used substances, including when someone was intoxicated or using drugs. Substances was interfering with a friend's life, or how to approach someone with concern. Personalization of experience makes an individual more involved and understanding the effects of using drugs or alcohol. Education and prevention programs vary depending on your community. In Shasta County, we found an education program sponsored by the Shasta County Chemical People. It's a nonprofit, community-based program which was started in 1983. The programs include Club Live, which is a middle school and elementary school-based program. They focus on alcohol, tobacco, and other drug prevention activities. Chapters choose a specific community focus project each year. Recent projects have been underage drinking and distracted driving. Shasta Peer Mentoring, which matches high school students and middle school students to help mentor the young people and helps them strengthen their relationships and helps them deal with challenges they face. This program started in 2001 in Shasta County. Friday Night Live, which is a state-based program, it started in 1984. It's on all the high school campuses. The program started out with preventing drinking and driving, but has shifted to a focus prominently on healthy lifestyles free of alcohol, tobacco, and substance abuse. And it's been in Shasta County since 1989. And I found a really cool quote from a club member from Friday Night Live. And it said, FNL is important to me because it is one of the few, possibly only programs in my community that helps prevent the use of drugs and alcohol in students. The next one is Sober Grad, which I'm sure all of you guys attended when you guys were high school seniors. The program is co-sponsored by the California Highway Patrol and provides a graduating senior a safe and sober event for graduation. It also started in Shasta County in 1992. According to the Shasta County Chemical People and the 2016-2017 school years, they asked the question to their participants regarding skill development. It said, working as part of a group, planning and organizing time, problem solving, and actively listening, solving issues in my community. 90% of the mentors said yes, and 84% of the proteges said yes. So you can tell that it's a pretty well-liked program by the participants. As you can see, education plays a vital role in someone's understanding and realizing the effects of drugs and alcohol plays in their lives and the lives of others. So next, we're going to talk about treatment. According to the Center for Disease Control, National Center for Health Statistics, there were an estimated 106,622 drug overdose in the U.S. last year, an increase of about 15% over 2020. Meanwhile, the CDC has estimated that alcohol-induced deaths rose more than 52,000 in 2021, an increase of 34%. Somewhere in the neighborhood of 21 million Americans are drug and alcohol addicts. It's pretty amazing. But once someone has made a choice on getting treatment, it's a big decision on what type of treatment they will receive to have a successful recovery. As of 2020, California had 1,734 nonprofit and for-profit treatment facilities. Treatment centers are used to help someone with a substance abuse problem. At these centers, people with substance abuse disorder can do inpatient or outpatient services. The most common inpatient program is for 90 days. It removes that person from their environment that they're most comfortable with. Programs will provide participants with resources to deal with their addiction by providing a combination of care, emotional support, and individual treatment plans. Outpatient services are used more widely, and they are comprised of a person with a substance abuse disorder completing a program while they're still in their own home or in their own environment. They can continue day-to-day schedules like work and family. A common outpatient program is Alcoholics Anonymous, AA, or Narcotics Anonymous, NA. It uses a 12-step religious program for treatment. Within the 12 steps, a participant will admit to having an addiction and that it's a problem. apologizing for their wrongs, and strive to do better. According to Aaron Bayard, Yichin Chin, and Tia Houston, in a study from 2018 to 21, found that the outpatient programs to be successful depends on the number of self-help groups attended during treatment and goals set by the client. Deciding to get treatment is one of the most crucial decisions that a person with a substance abuse disorder must make. Now, Isabel is going to conclude our presentation.
Last but not least, according to Romeo Vitelli in his book about substance abuse in 2018, it said that according to the most drug authorities, any substance can be addictive if it has psychoactive effects. If it has psychoactive effects, can promote a self-reinforcing pattern of use and can lead to cravings and unpleasant psychological effects following withdrawal. While these symptoms are most commonly associated with well-known drugs, such as heroin and cocaine, there are many other substances that are also prime candidates for abuse. This is able to bring up the ideas of alcohol or medication prescriptions as addictions as well. As we see throughout this presentation, there are so many different leading factors to the idea of being addicted to a substance. There are so many courses, whether simple or quite difficult, many people will fight for their need for substances. There are many great options for recovery, going to mental health resources and more. We already have ideas contributing to this with something as simple as sober grad contributions. So the next time someone is highly intoxicated, talk to them because the possibility of some background issues may lie. You could be the next person to save someone's life. We hope this presentation brought you some information you possibly didn't know of and can lead to helping many people with substance abuse problems. Thank you.
Yay.
That's very good.
Very good. Good job.
Your presentation is like cute, like the layout and the pink and stuff.
I know they're
It's
all
very
related.
cute.
I like that.
Yeah. And I like the medicine and stuff. That was really cute.
Oh.
Ah,
I like that you guys covered addiction and we talked about a type of addiction. Like we were the best group to meet.
Yeah.
funny.